But I think we'd like to first lead with a question they don't have, but I think they could probably expect this morning. It's certainly been an interesting 24 hours in the Commonwealth, and I guess as our leadoff question, I'd like to sort of ask the panel members, in the format, of course, we have one microphone, and we'd like to just sort of pass it to each of the people who are speaking, and try to, as best we can, so everyone has an opportunity. So everyone has an opportunity to speak. Try to keep your responses as brief as possible, and thank you for that in advance. With the recent election of Scott Brown to the U.S. Senate, is the administration's national health care program doomed, given that election?
I think there'll be three possible scenarios that will go forward, particularly as a result of the fallout from the election. And I don't know if any of you saw just one gigantic smile back there earlier. George Peterson, in his rare opportunity to gloat, was here this morning, and I think he just took off after everybody congratulated him. Not that he had much to do with it, but nevertheless, he'll take credit for it. There are three things that could happen. I'll end with the one that I hope will happen. One is that the plan totally collapses and nobody talks about health care for another 10 years or 15 years, as happened last time. I don't think that's likely, and I don't think that necessarily is good, because we do need to address health care costs in particular over this next 5 to 10 year period, because we can't sustain the kind of increases that have been going on. So we do need to do something. The possibility, of course, is that the Congress, the House, could agree with the Senate and avoid another, simply concur with the Senate and avoid the Senate having to come up with the 60 votes. Or they could, and they could stall, of course, too. But I think the issue is really going to be that, I hope will happen, is that the Democrats will reach out to the Republicans and vice versa, and that they'll try to come up with a program that does address some of the real issues in health care. There's probably about 2/3 of the bills that are there have support from both parties, and they ought to focus on that. Maybe see if there's a few other things they can agree on and get something done, and then turn their attention back where it should have been all along, to dealing with the economy other than printing more money. And hopefully that will be the direction it takes, and that this is the message it gets. Now, that might be very optimistic thinking, but I think that would be the one that would be the most productive for all of us.
Anyone else like to take that question? Senator?
That's okay, that's far enough. As the Senator said, this issue is too important right now for it not to be addressed. As the chairman of small business for the Senate, we've been touring the state, meeting with the chambers and having forums with small businesses, and this is one of the primary topics that comes up, is the cost of health care to small businesses. So if we are going to help the economy, small businesses is 80% of the backbone of our economy, so we really need to address the costs for them. So I do hope that the results of this election is that we are going to have a bipartisan piece that comes out that's going to get supports of both branches and help resolve this issue.
I actually get to see this on both sides as a business owner. The increase in insurance premiums since I first started my business 10 years ago has gone through the roof, and unfortunately, what I like to do with my employees is improve their lives, with more money, and so they can just get things, houses, cars, or whatever they need. And unfortunately, the health insurance is really made that whole situation stagnant, because it keeps going up, and that's like their raise is their health insurance. And so it's tough on the business side. On the other side, I spent quite a bit of time up at the State House and up at Healthcare Finance and Policy over the past couple of weeks. And Medicaid, on the other hand, is trying to cut their fee schedule for medical supplies. Actually, I was reimbursed more in 2001 than I'm being reimbursed right now.